Hello, this is Elisa again, and I wanted to finish up my introduction video that I started a couple days ago. I wanted to give you an idea of what exactly I'm going to be talking about for the next few months. I will be discussing VNS therapy, my decision for pursuing VNS therapy, my decision-making process, and the steps to take if you decide that you are interested in VNS therapy. I will also document my journey from the initial consult with the surgeon all the way through hopefully a year follow-up. I want to make sure that people will get to see what surgery is like before and after and during the process of programming, and hopefully the achievement of seizure freedom or reduction of seizures or reduction of severity of seizures. VNS stands for vagus nerve stimulator. So if you have no idea what VNS is, that's what it is. Your vagus nerve is a nerve that starts in your brain around the circle of Willis. That probably means nothing to most of you. So let's get out of the medical term. The vagus nerve affects your breathing and your heart rate and your digestion, involuntary functions. So you breathe whether you're thinking about it or not. Your heart beats whether you think about it or not. Your stomach still digests whether you're thinking about it or not. Your vagus nerve is the nerve that handles all of those functions. In the surgery, they will make a small incision in the neck and wrap a lead around the vagus nerve, and then they will attach that to an implanted processor in your chest. And after 2 weeks, when you start to recover, the neurologist will program that in order to have a period of on and a period of off. So it rhythmically will send electrical current to your brain to fire those neurons, so it'll counteract or prevent misfiring to keep the surgery or the seizures at bay. Anyway, so it is a surgery, and they are cutting into you and implanting something in you, and it's something definitely more severe than medication, but it has the same type of success rate. Not all medication works for people, and not all people do well on VNS therapy. I'm hoping that I'm one of the 30% that seizures are completely eliminated, or at least to the other 30% where seizures, the amount of seizures are reduced or the severity of the seizures are reduced. Either way, I'll think it's a success. And if I'm the third that it doesn't help at all, at least I'll have this vlog to show others what the process is, and maybe give you some comfort in going into the same process. If you decide to, whether or not it works for me does not matter. It may work for you, it may not work for you. It's a treatment option just like any other. It's not a cure. We don't have one of those yet. We don't have any way of preventing epilepsy. We don't have a cure for epilepsy. It's just something that we have to manage. So this is just an option of how to manage it for those people who anti-epileptic drugs just don't work for. I know that there's several people out there, thousands, millions of people out there that probably have been on a list of medications and they don't work, or they can't find a good combination, or the side effects are just so horrible that you can't stand them. I am not one of those. I've been on 3. I was on Topamax. They gradually took me up to the highest dosage possible, and I was still having grand mal seizures. So they switched me to Lamictal, starting me on a lower dose, and weaned me off of Topamax and put me on Lamictal only. And with that, I stopped having grand mals. But I was still having absence seizures and myoclonic. And so they put me on Keppra and Lamictal, a lower dose of Keppra and the highest dose I could handle of Lamictal, without suffering from major dizzy spells or severe depression. So Keppra was added, and let's see, it's a great drug. Very little side effects. I mean, for me anyway. There's a whole long list, and some people they just don't handle Keppra well at all. And for me, Keppra and Lamictal work wonderfully together. But over the years, I've had to up my dosage, and now it's not working well. And I've also started having simple partial seizures, which are starting to really affect my work, and they're becoming more frequent, which for me I'm not used to. I had like when I first started having seizures, I had maybe a grand mal a month. Of course, I was having over 100 absence seizures in one day, but those never seemed like they were that big of a deal, because I just seemed like a spacey, ditzy little girl. I was a teenager, so it seemed common. Became a little more disruptive in life when prevented me from driving or paying attention in my college courses, and missing important information that I needed for tests. But anyway, I'm tired of trying medication, and I may have to try different medications, but for now, I'm going to move forward with VNS Therapy, and I'll explain those decisions a little bit later. Right now, I kind of want to go hug my baby and kiss my husband and go to bed. I am going to have a surgical consult on Monday, so if you have any questions that you would like to ask a surgeon regarding VNS, about the surgery itself, about recovery period and things like that you would like them to answer, go ahead and let me know, and I will. I'll try to get those questions answered. And if I don't hear from anybody, I will get as many questions of my own answered, and I will let you know what those answers are along with the questions. But I'm really, really looking forward to getting it done. The next time you see me, I will have my head full of electrodes. I'm going to have a 3-day EEG done this weekend, so they'll come in and put it on Friday. I'll probably want to vlog about it to give you guys an idea of what kind of testing is required for VNS, and then that'll be taken off. I'll do the consult, and then hopefully I will get approved through insurance for this surgery, and I will get that scheduled, and I will let you guys in on the whole process. So if you do have a question, I really don't know how to do the whole YouTube thing. I've posted this on several epilepsy support sites on Facebook, So I'm just going to give you guys my email address right now. And if you have a question, email me. It's alisacrg4@gmail.com. So that is ALISACRG4, the number 4, at gmail.com. And if I don't get any questions, that's cool. But I'm just wanting to help out whoever's out there who would like questions answered. Okay, well, have a good night, guys. Have a good night.